Under apartheid in South Africa, doctors and psychiatrists alike took part in a large-scale, unprincipled system which systematically oppressed minority groups in the nation and repeatedly mistreated prisoners. Medical personnel were known to have been abusive towards prisoners since as early as 1969, the year when psychiatrists of the South African Defense Force first began directing their attention towards homosexual conscripts and curing them of their romantic orientation through immoral means. What would eventually evolve into one of the most unspeakable events resulting from apartheid ties back to a series of South African military policies regarding homosexuality in soldiers. Homosexuals were widely prohibited from joining the military, though authorities made notable exceptions for draftees who were believed to have been using their sexuality to conveniently evade serving. The already aggressive SADF viewed this behavior as subversive, and they aimed to manipulate the sexualities of permanent military members by penalizing their tendencies during a number of psychological experiments. Psychiatrists working under the South African military utilized forced therapy on active homosexual members, including but not limited to compulsion shock therapy, conversion therapy, and castration. At the time, homosexuality was defined as a mental illness under the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. Subsequently, gay soldiers were treated far differently by authority figures, as they never received leadership positions in the military, nor were they entrusted with any sensitive information due to their perceived illness. Eventually, a program was established to identify any homosexual or drug-abusing conscripts in the SADF and subject them to rigorous punishment until they were entirely cured. Leading what was officially designated as the Aversion Project was one Aubrey Levin, a South African-born psychiatrist who ran the remote Ward 22 at one military hospital in Pretoria. Many patients were to be treated in this ward, including homosexuals who were grouped alongside the likes of drug abusers, political prisoners, and seriously mentally ill individuals. Levin believed similar procedures done on these groups could be implemented in treating homosexual military personnel, and began the Aversion Project with a team of 24 other doctors to highlight this. Following review, South Africa's Truth and Reconciliation Commission informed Levin's team of how their work to forcibly convert homosexuals would be a strict violation of human rights. However, Levin and company carried out the program regardless. What ensued can only be described as medical torture. Following a screening period, selected homosexual soldiers were sent to Ward 22 to undergo behavior therapy. Any victims who resisted were threatened with severe punishment. The earliest experiments saw male subjects, typically aged between 16 to 24, receiving crude shock therapy, with electrodes strapped to their upper arms, shocking them on a current severity scale of 1 to 10. To begin, the subjects were shown monochrome photos of naked men, which were intended to stimulate arousal. If the men displayed any sexual reactions to the pictures, they were shocked as negative punishment, with the voltage intensity amplifying over time. Subjects were then shown colored Playboy magazines and encouraged to fantasize over the female models pictured, though their sexual preferences failed to change following experimentation. Those who failed to show the desired results and needed additional curing were subjected to further, even more unjustifiable operations, such as gender reassignment surgery and chemical castrations. Even following the APA's declassification of homosexuality as an illness in 1973, sex change operations were carried out on as many as 900 homosexuals, roughly 50 a year for 18 years. Men, and later women, were sent to military hospitals where surgery was to be performed on their genitals without informed consent. Some patients required extra surgery, and a considerable number died while under or as a result of these operations. If they did survive, patients were then discharged and given entirely new identities, forced to separate from their friends and family while unwillingly living the life of the opposite gender. Notably, Many patients were left with incomplete procedures and never had opportunities for a follow-up appointment, nor received additional mental or physical health checks. This much personal change, taking place at such unprecedented rates, was an unfathomable burden for many patients, with a majority later falling into severe depression or committing suicide following operations. Psychiatrists of the Aversion Project ignored all scientific evidence against sexuality altering and were instead driven by harmful gender fallacies regarding homosexuals. The same SADF policies of before were taken to the extreme, with surgeries intended to correct a patient's gender and subsequently end their preference for the same sex. Though ultimately, the results were unsatisfactory for both therapists and patients. With high casualty rates and circulating rumors of inhumane experimentation causing uproar in South Africa, treatment for homosexual soldiers began declining in the late 70s. Details of the Aversion Project were later brought to the media's attention at hearings of the Truth and Reconciliation Commission, where the findings of thorough investigations into its programs were presented for the world to view in horror. Years after the end of apartheid in 1995, the Medical Association of South Africa publicly apologized for the human rights abuse which took place during the Aversion Project. Levin himself stated every patient volunteered for their surgeries. The former colonel has also been found guilty of medical malpractice on homosexuals on several occasions, and was later sentenced to 5 years in prison on April 23, 2014. The injustices of the Aversion Project continued to be brought up by all who were affected, highlighting physical, emotional, and medical abuse in what has since been considered one of the most unethical experiments in history. The ethics of animal testing have been extensively debated for centuries on end. Some believe because animals are inferior to the advanced Homo sapiens, they are the perfect candidates for experimentation which will advance both biological knowledge and the field of medicine. Others firmly state these benefits do not warrant the animal cruelty imposed on these creatures in various cases, and strongly advocate for animal rights and research studies. What cannot be justified is the psychological torture of animals, carried out by destroying their social traits and emotional state, solely for publicity in scientific communities and sadistic satisfaction. Harry Harlow, an American comparative psychologist, went about achieving public notoriety in controversial fashion, as he spent much of his career exploring the nature of love between biological mothers and their children in some of the most vexed experiments from recent memory. Harlow had been suffering from severe depression as a result of his wife passing away from cancer in 1971. The psychologist eventually returned to his work after taking time off to mourn, but Harlow's colleagues were growing aware of a notable change in his psyche. Once passionately invested in maternal attachment, Harlow abandoned his previous works for psychological research on depression and isolation in the months following his wife's death, feelings he was all too familiar with himself. Harlow's earliest experiments aimed to highlight the importance of parental bonds and companionship in early life, as well as display the deep yearning infants felt for a parental figure who provided not only food or protection, but a sincere form of affection. Using rhesus macaque monkeys as test subjects, the early 20th century idea of conditioning an infant into being a stable adult through the likes of isolation and rejection was thoroughly examined. Harlow, along with several of his students at the University of Wisconsin-Madison, began entrapping rhesus monkey infants in a small steel cage known as a vertical chamber apparatus, closed off with a one-way mirror for experimenters to look into. These monkeys were entirely isolated from the outside world for prolonged periods, with the only contact they ever had being when an experimenter reached their hands into the cage to deliver food and water as well as change their bedding. 12 monkeys, ranging from 3 months old to 3 years old, were put in these isolation chambers and grouped into 3 separate time frames. 4 were left for 1 month, 4 were left for 6 months, and 4 were left for a year. Regardless of the length of their stay, nearly all monkeys are found to have been psychologically damaged and emotionally distant just days after being placed inside. Animals who were once developing natural social bonds with one another became broken beyond repair. The monkeys, isolated for a month, remained huddled inside their cage, refused to eat their food rations, and lost any sense of curiosity they once possessed. Harlow labeled these monkeys as enormously disturbed, unable to even interact with others of their kind, and were bullied by more sociable monkeys when they were placed in a play session. According to reports, numerous monkeys had also starved themselves to death during their stay. Further into his experiment, Harlow wished to underline the differences in parenting skills between a typical monkey and a total isolate, doing so with a device he chorously named the rack. Because artificial insemination could not be done, female monkeys were tied to the rack and forcefully impregnated. Following birth, the isolated monkeys frequently neglected and abused their offspring and displayed zero parenting skills. As a matter of fact, the mothers grew horrifically violent. Reports state one mother chewed off her baby's feet and fingers while pinning his face to the floor, and another had crushed her baby's skull. Not only did Harlow's experiments display the harrowing effects of total isolation on developing infants, but the research ultimately served as an animal model of human depression. Each monkey finished experimentation in a psychotic state after remaining entrapped in a hopeless situation, and they would never recover from this detachment for the remainder of their lives. Harlow was well aware of the cold-hearted nature of his experiment, and of the torture he was inflicting on these infant monkeys. To him, the animals were less than beings with emotions and a beating heart, but instead property to exploit for his sole gain. Harlow utilized a desolate, suffocating chamber to break down his animal subjects to their very core, all as a means of capturing the helplessness and emotional torture endured in human clinical depression, as if, in the words of Harlow, one was sunk in the depths of despair. Harlow's experiments were, and continue to be, condemned in the strongest of possible terms by animal research officials. Many were appalled by the meticulous designing of the Well of Despair chambers, and decried his devout effort to inflict as much psychological torment on the monkey subjects as possible as an utter violation of natural life. The history of the Holmesburg prison, notoriously nicknamed the Terror Dome, is marked by corruption, inhumanity, and a series of distasteful experiments. First opening in 1896, the Holmesburg prison began housing inmates in Philadelphia, Pennsylvania, when the nearby Amelia-Mensing prison grew overcrowded and an additional site was needed to send over prisoners. Plans went accordingly until the Holmesburg prison was eventually filled to capacity itself, leading to riots, hunger strikes, and guards abusing their power, sometimes lethally, to ensure their safety. The prison had been in a state of unrest for years, but its darkest period had yet to arrive. During the 20th century, prisons were often used as sites for psychological experiments and medical research, as negligence towards the rights of inmates provided experimenters more moral leeway in their tests and also gave them access to human subjects. The Holmesburg prison was no exception to this, and allowed for Dr. Albert Kligman, a dermatologist and Philadelphia native, to take advantage of its prisoners by transforming the facility into a human laboratory of sorts, initiating human experiments which aim to advance dermatological science and study the effects of various substances on human skin. What began as conducted research over skincare products, pharmaceuticals, and harmless chemical agents later evolved into years of unethical practices, as teams of scientists went on to expose Holmesburg inmates to the likes of skin-blistering chemicals, psychoactive drugs, and radioactive isotopes. From the 1950s to the 1970s, 80 to 90% of Holmesburg's 1,200 prisoners, a majority of whom were African American men, were persuaded to take part in inhumane trials as subjects, with minor financial incentives. Though very few were aware of the risks regarding this experimentation, inmates chose to follow through solely to earn money for their freedom, as they had the opportunity to prematurely end their sentence if they could pay 10% of their bail amount. During Kligman's experimentation, inmates were exposed to dioxins, microwave radiation, and acids through injections, ingestion, and topical application. These solutions corroded the skin of inmates, extensively damaging their bodies beyond recovery. Experimenters also asked prisoners to physically harm themselves by cutting off their sweat glands for further examination, and they were occasionally drugged with mind-altering hallucinogens without having been informed. Inmates suffered severe health effects during and after experimentation and received little to no medical care from psychiatrists, with reports of liver damage, brain damage, and skin cancer all emerging in later years. The Holmesburg trials' chemical testing, radioactive testing, and dioxin testing became the subject of controversy for being direct breaches of the Nuremberg Code, which had established a set of ethical guidelines for human experimentation. Instead of informing inmates of the harmful chemicals they'd be subjected to, experimenters exploited their situation and promised nothing more than a monetary reward and credit towards scientific advancements. Research on retinoid compounds was said to have largely contributed to the development of Retin A medication primarily used to treat acne and other related skin conditions. But despite any medical benefits which may have emerged from the Holmesburg trials, and administrators such as Solomon McBride remaining adamant about the legality of the experimentation, all future advancements came at a substantial moral cost. Holmesburg prisoners were physically scarred and violated by researchers who failed to take any ethical precautions. The Holmesburg trials raised many moral concerns in later years, particularly when the public learned experimenters deliberately concealed information regarding what substances would be used on inmates during testing. While discussions over the infamous Tuskegee Project were already prevalent, the public viewed these trials in an equally negative light, and organizations associated with experimentation received significant backlash for their usage of incarcerated African Americans as guinea pigs. The violation of ethical principles in Kligman's experiments not only underlined the dangers of human experimentation for commercial interest, but brought more light on the cruelty endured by prisoners in the 60s and 70s, as well as a general lack of inmate rights. Holmesburg Prison was ultimately decommissioned in 1995 and shut down altogether not long after. Ex-prisoners eventually went on to sue the likes of Kligman, Johnson & Johnson, and the University of Pennsylvania for their inhumane testing in 2000. However, because the statute of limitations had passed by this time, their cases were largely dismissed. Decades following the end of the Holmesburg trials, the city of Philadelphia issued an apology for past experimentation in 2022. But discourse continues about experimenters adhering to ethical standards and providing prison reform as opposed to more exploitation. Today, families of the victims still demand reparations for the psychological after effects of the Holmesburg trials. And the breaching of personal ethics has influenced many moral standards in use for modern research. In the years leading up to World War II, the Imperial Japanese Army had committed a series of horrific war crimes across Eastern Asia out of pure hatred, including the likes of the Nanking Massacre and countless other violent atrocities inflicted on Chinese civilians during the Second Sino-Japanese War. The Japanese not only murdered hundreds of thousands of innocents, but took just as many in for human experimentation, comparable to the unspeakable crimes committed within Auschwitz. During the mid-1930s, the Japanese began secretly constructing a bioweapon facility known as Unit 731 in the Pingfang district of Harbin, with a testing program officially founded in 1936. Initially, the facility served as a testing ground, which saw soldiers voluntarily participating in experiments which evaluated the human body's endurance towards diseases, starvation, and dehydration. The medical research conducted proved to be beneficial for the Japanese army, and thus far was obtained consensually. But this would dramatically change as Imperial Japan's attitude grew harsher as World War II intensified. A biochemical weapons program was established in response to the Geneva Protocol of 1925, which had prohibited the usage of such weapons in wartime combat. Instead of backing down, the Japanese viewed the treaty only as motivation to manufacture more lethal chemical weapons, as a means of achieving a competitive advantage against opposing forces. Unit 731 was utilized by authorities not only for its geographical location, as the facility was far from Japan's main island, but also for the access it gave experimenters to Chinese civilians and local war prisoners. Well aware of the forbidden nature of this project, the Japanese prioritized using locals and prisoners of war as test subjects, who were already considered subhuman and given zero choice in their participation. Beginning in 1937, the Japanese detained thousands of Chinese and Russian victims, as well as smaller groups of Koreans and Mongolians, in several of Unit 731's 150 structures for experimental purposes. Lieutenant General Shiro Ishii took over the unit not long after it was founded and established a military organization known as the Ishii Network, which aimed to expand upon Japan's biological weaponry with support from the Japanese government. Within the walls of these buildings, Ishii and his team conducted some of the most despicable human experiments in recorded history, subjecting victims to the likes of amputation, bioweapons testing, disease testing, frostbite testing, vivisection, and sexual assaults, among many other war crimes. Scientists infected thousands of test subjects with syphilis and numerous other diseases, sometimes multiple at once, to see how their bodies would react to pathogens and in attempts to create new diseases. The experimenters dehumanized their victims by constantly referring to them as logs and placing them within log cabins where experimentation was conducted against their will. Weapons testing was often carried out on prisoners with the likes of knives, flamethrowers, gas chambers, and X-ray exposure, either permanently injuring or killing all of them. Unit 731 workers also aimed to experiment on their subjects through the likes of and forced pregnancy, as they demanded infected male prisoners to either female or other male prisoners to observe how diseases such as syphilis, cholera, and the bubonic plague spread in their bodies. Whenever women were impregnated, live vivisections were performed on them in order to closely examine the effects these diseases had on a fetus. The sheer brutality and inhumanity witnessed on Unit 731 grounds couldn't be properly described with any vocabulary, and yet the Japanese carried out this torture in the name of world dominance and scientific research. Japanese authorities went on to use bioweapons tested on prisoners against local Chinese cities and opposing forces, resulting in the infection of hundreds of thousands of more civilians, directly related to Unit 731 experimentation. Despite their best war efforts, defeat was imminent for the Japanese Empire by the mid-1940s. Realizing Unit 731 was a lost cause, a majority of experiment files were destroyed, and any remaining prisoners were killed to conceal testing evidence. No Unit 731 victims were documented to have survived. Unit 731 was officially terminated shortly following Japan's surrender during World War II in August of 1945, but the surrounding controversy carried on decades after. Due to the destruction of evidence, very little is known about the workers once behind Unit 731, and very little justice has been served. The Japanese government refused to acknowledge Unit 731's existence until 1988, and didn't apologize for its atrocities until even later. It was instead the Chinese who shed light on the horrors their victims endured during these experiments, even building a museum where Unit 731 was once located in 1982. World powers such as the United States and the Soviet Union collected data from Unit 731 following Japan's collapse, with researchers receiving light sentences in exchange for their information. Notably, the Harry S. Truman administration contributed to the cover-up of Unit 731's testing, and even provided stipends and immunity to experimenters, as American authorities believed further pursuing trials would risk leaking valuable knowledge to the Soviets. In Unit 731's 9 years of experimentation, over 14,000 victims were murdered while imprisoned. At least 200,000 died from external biological warfare, and many of the perpetrators lived on without punishment. What is considered to be the single largest and most devastating genocide in history. The Holocaust saw over 6 million Jewish men, women, and children being systematically murdered by Nazi forces in concentration camps across Europe. The evil imposed on the Jewish population as a means of ethnic cleansing cannot be adequately described. Not only were both Jewish and non-Jewish groups massacred over anti-Semitic and racist principles, but many became the victims of heinous medical experiments in the name of racial supremacy in German scientific advancements. Though experimentation was widespread, a majority took place in the extermination camp complex of Auschwitz in occupied Poland, the largest of Nazi Germany's camps, and where over 1.1 million lost their lives. Funded and initiated by German figures such as Reichsführer Heinrich Himmler, physician Ernst Grawitz, and Standartenführer Wolfram Sievers. Teams of German physicians carried out criminal psychological testing on concentration camp prisoners, which ultimately resulted in the murders of the mentally ill and physically handicapped. Experimenters were not simply testing to further medical research and obtain valuable knowledge. They were deliberate perpetrators of killing programs, which aimed to physically exploit inmates in Auschwitz and murder them after forcing them to suffer through torturous operations. Auschwitz experiments were planned out by high-level politicians in order to assist the German army during warfare and advance Nazi Germany in scientific fields during post-war periods. Authorities also used these experiments to reinforce the basis of racial purity, as they believed a mass Jewish cleansing would ensure the superiority of the Aryan race. On lower levels, Nazi doctors put human subjects through inhospitable conditions on behalf of German pharmaceutical companies, as well as for their personal benefit. In countless operations, inmates were subjected to agonizing experiments involving freezing, exposure to deadly diseases, surgery without anesthesia, and bone transplantation, just to name a few. One of the most common experiments on Jewish women especially was artificial insemination. To breed more children of the superior race, German doctors forcibly impregnated thousands of women with sperm belonging to SS officers, often doing so multiple times. The women were closely monitored by doctors during pregnancy and forced to endure extensive suffering while living in horrid conditions for both themselves and their unborn children. Other German doctors, such as Sigmund Rascher and Bruno Weber, conducted a series of blood coagulation experiments to discover methods to reduce bleeding from gunshot wounds, as well as to test the compatibility of blood types. In Auschwitz, subjects were injected with blood types different from their own, causing their blood cells to congeal. As Nazis removed this blood from a patient's body for studying, they usually struck a major artery and caused them to die of significant blood loss. German doctors also carried out experiments on twins, involving limb amputations, cyanide injections, and sex reassignment surgeries. The most well-known of operations were spearheaded by Nazi physician Josef Mengele infamously known as the Angel of Death. Mengele and his team gathered twins in camps and assigned a subject and a control within each pair, as they aimed to obtain further knowledge on twin reproduction and interaction. Auschwitz survivors, such as Eva Moses Kor, have recalled the many deliberate infections and amputations of healthy limbs done on twins, leading to the deaths of roughly 1,300 twin subjects in total. If subjects did not die during these procedures and lived through the likes of genital experimentation and incompatible blood transfusion, they would still be killed off and dissected post-mortem, occasionally even being massacred without experimental purpose. Human experimentation in Auschwitz was prevalent years after initially being established by the Nazis in 1940. 15,754 prisoners have been documented as victims of medical experiments between 1942 and 1945 alone, with a majority of historians believing this number to be even larger unofficially. Those who did survive Nazi Germany's treatment suffered severe permanent injuries, incurable defects or illnesses, and eternal physical and psychological scarring. Following Germany's defeat, the doctors' trial was held by the United States, which prosecuted Nazi Germany for their crimes against humanity, even with the emergence of countless real-world horror stories and testimonies emphasizing the inhumanity witnessed in Auschwitz. Very few German doctors involved in human experimentation were properly indicted and received rather light sentences, whether it was due to the information they had obtained or pure systematic bias. As much as the Germans tried to conceal their criminal acts, the lasting effects of their operations are still spoken of today by surviving victims, whose harrowing accounts will forever be immortalized as parts of the darkest chapters of the world's history books. The Nuremberg Code was established on August 9, 1947, as a direct result of experimentation in Auschwitz, addressing the human rights abuse at the hands of medical professionals, and laying emphasis on the 4 ethical principles of beneficence, non-maleficence, autonomy, and justice. This has been Zen. Take care.